A better world in terms of mental health for me is one where consumers and carers are part of the process of service delivery.
I think having a good family relationship, having my family members understand me and me understand my family members.
A better world for me would be a world where people find it easier to come out and say actually what's going on for them, how they're feeling when they're feeling like very depressed and suicidal and things like that. Being able to talk about how life is.
I think a better world for me, mental health, is for people to have a greater understanding of mental distress and not see it as a different thing to a physical thing. So more acceptance of just seeing it as the same as a physical thing and supporting somebody like you would support somebody if they had cancer or a broken leg, rather than the fear and stigma that's involved in mental health.
Be one where people with a lived experience of mental illness can live in a world that does not judge them, fear them, pity them or discriminate against them, and where they are judged by their character and what they can value add to society, and not by their disability but by their ability.
That all people are equal, that we're all treated the same way, that people with mental illness have got feelings and belong in this world just as much as everybody else, and they have the right to feel safe and belong.
It looks like a health service and whole community that doesn't discriminate against people with mental illness, and that we're treated equitably, not just equally.
For me, a better mental health world means a world where people know what services are available, how to access those, and are aware that they can have access to services without fear of any sort of judgment or stigma being attached to them for that.
It's a partnership. It's taking away the fear. It's taking away the fear that people with mental illness are something that we need to treat, fix, or be scared of or fearful of. Because the reality is we all have degrees of mental distress or illness sometime in our life. So it's not about them over there, it's about us and us within a community setting.
I think we need to get to a stage where we do understand that mental illness is not a demonic possession, and even though most people wouldn't say that, that's how they react. That it's not catching, that it's something we all have a stake in. I think that's the main thing, and I think also the government needs to put as much money into mental health as it does into other illnesses in the community, so that it gets enough money to cover the burden of disease.
I think by having far greater understanding, listening to consumers and carers rather than telling them, that's about.
It's a whole community approach, so a big part of it is about that education at every level. So whether that's, schools, or talking to those frontline workers like police officers and paramedics, and upskilling doctors and the services that already exist in the community, so people know what the signs and symptoms are and where they can go to get support if they need it.
We make that happen through people being understanding by using peer specialists, people who understand what it feels like, who can help them to join up the services and make sense of the environment around them that can support them in whatever that might be, through to housing, employment, families and medical support.
Maybe a world where we don't have a mental health unit in a hospital, where it's just a hospital and it doesn't matter what mental illness you've got. You can be in a ward with someone with schizophrenia sitting beside you, and you've got a broken leg and someone's getting their tonsils out next door to you.
People would feel more secure in their life there'd be more happiness around, there'd be more community involvement. People would feel safe walking around, not feel that they were being victimised by other people, bullied, or I just feel that there's too much trouble in this world. We need to live peacefully and support other people that need the support.
We only ask people about their recovery journey while they're using services. We don't really, people should come and ask me now, 10 years down the track, can you tell me what happened for you that worked for you? That's the big question. And the thing that worked for me was being able to link up with my peers in the self-help group. That's when we need to be asking people long term what worked for you down the track.
We'll know because we won't have so many people isolating and terrified of going out into the community, that there'll be services that include them, that they'll be able to work and still disclose and be looked after in workplaces, that we won't have people queuing up to get into acute wards, that we'll have enough supported housing, that people don't need to be on the street or end up in jail. So there's a whole lot of things that could show that we're in the right direction.
We probably wouldn't need acute services then. You know, we'd have early intervention and support and consumer-led so that we would recover in the way that we want to recover. I don't want to go back into hospital. I don't ever want to go back in there again. And with my husband and people around me support me to stay out of hospital even when I'm extremely unwell. But we're doing it, and I get better faster by that.
The increase in awareness of mental health issues and the reduction of stigma in the last 10, even 5 years has been massive, but we do still have a way to go, and I think it's going to take a lot of work at that high up government national level, but also, you know, going down through the lines and into individual communities and working with what people need on that individual basis, because obviously what someone needs out in rural WA is completely different to someone living in the heart of Melbourne.
From the viewpoint that we can go to a health service and we are treated exactly the same with the respect, care and concern as other types of illnesses, be it diabetes, be it asthma. No difference. They're all legitimate illnesses, including mental illness. It means that when someone goes into an emergency department, that they're not red flagged as a risk. They're treated with respect. They're given the same sort of care and concern as someone who walked in with a broken leg, for example. They're not put at the back of a list till people fix up the bleeding, because the pain is as severe that's occurring without the obvious evidence of blood loss. It's about families understanding that for a while there are an illness that may overtake the experience of the loved one that they've normally been used to. And it's about helping to support carers and others in understanding that this time it's the illness, it's not you, or it's not the person. So we help people to help themselves. It's also about government taking responsibility and not creating a subculture of unpaid workers, being families, friends and others that give up career choices, that give up paid occupations of all sorts of descriptions because they have no option. They must stay at home to care for someone that they love. That is actually a whole of community and government responsibility, not to a select few.